EEG is an extracellular recording of the electrical activity of the brain by placing surface electrodes on the scalp. Different areas in the scalp. As I have placed this headphone there, and maybe we have such type of placements. Only thing that you cannot place it on the head, over the head, over the hair, because the hair does not allow the electrical activity to pass through. You can just check it. Okay. So you can see these electrical activities by placing electrodes, and these are the electrical activity. As we are recording ECG, placing electrodes at the limb or on the heart, same thing here, the electrical activity. However, the heart activity is very synchronous and very fine. That is why we get a very big waves. And here, these activities are not very synchronous. There is no pattern. So under such circumstances, we have to evaluate certain pattern. Even in this chaos or in this chaotic situation, there is some order, and that order we are trying to see today. So there are, even before EEG has started, there is whatever another term where the scientists were placing the electrodes on the surface of the cortex. By placing the electrodes on the surface of the cortex, they were recording the electrical activity, and that is known as electrocardiograph. I have given two terms here. Electroencephalogram records the activity when we have placed on the scalp, and electrocardiogram wherein we place the electrodes on the cortex directly. So that is only possible in electrocardiogram. We can record only in experimental animals, or sometimes in neurosurgery. Wherein we want to see the activity when somebody is doing some intra-operational, doing some surgery somewhere near thalamus or some other areas, how they are doing, what is happening, which fibers are being activated. So during that time, ECG may be useful there during the intraoperative period in neurosurgery. Okay, now coming back, what is the basis of these activities? So as we have seen, the basis of it is similar to the basis of the ECG. That is the electrical activity picked up by the electrodes. These electrical activity is generated by the current sinks by the movement of the dipoles in a volume conductor. Body is a volume conductor, and dipole is a structure which is a part which is separated by two different polarities. So that means a membrane is a dipole. So wherein on one side you have a positivity, on the other side you have a negativity. Another condition of the dipole is that infinitesimally small distance. These two charges are separate, two separate charges are separated by infinitesimally small distance. So that is exactly dipole. These are moving, and moving in a volume conductor, they create a current sink, and these current sinks are picked up by the electrodes, placed on the surface, and these are whatever these current sinks are summated. That means whatever is happening in a particular area are summated, and we will get the what is called some activity, unified activity. So those are picked up by the electrodes. Activities generated by the brain surface are small and are primarily from the dendritic depolarizations. So the dendrites, because you have that you see the cortex. The cortex has 6 layers. The outer layer is the plexiform layer. This plexiform layer is only the dendrites, especially the dendrites coming from the layer 5 and other layer 6. These are the things they project on. They make the dendritic arborizations throughout these things, even from the layer 4 also. So these dendritic arborizations, they will be reaching there in the outer molecular or reflexiform layer, and they will be recorded. Since these activities are not synchronized, because there is a total chaos in the system, they are not synchronized, they are asynchronous, and some of them are going up, some are coming down. When algebraically we submit, so those who are coming down will neutralize those who are coming up, so that we will have a voltages very small. So these voltages are in microvolts. Microvolts means 1,000th of a millivolt. 1 millivolt is a 1,000th of a volt. You can just say 1,000th of a volt is a 1 millivolt, and 1,000th of a millivolt is a microvolt. So that means such a small dimensions. So that means you require an amplifier system which is what you are using in ECG. It is 1,000 times amplified. Here, at least you should have an amplifier system which is 10,000 or 100,000 times amplified. So then only you will be able to record the EEG activity. So just I am trying to impress upon you what is the instrument or amplifier requirement for these recording these activities. Now coming back, so the brain areas involved are which of those brain areas which produce these activities? So we have seen that these areas are mainly coming from the thalamocortical projections. Suppose if the brain is disconnected from the thalamus, you will not have those wave patterns. So that means it is the brain areas, especially the thalamus, is involved. In the thalamus, which part of the thalamus is involved? Though we were trying to tell about the functions of various areas of the thalamus. There are specific areas, there are association areas, there are non-specific areas. It is the non-specific area, especially the reticular nucleus of thalamus and the interlaminar nucleus of the thalamus, where this interlaminar nucleus projects onto the entire cortical surface. So that means this is very important, this thalamocortical projection that creates the alpha waves. Now, I will come back to that alpha waves later on. But so now, then stimulation of the thalamus at a particular frequency sets in the wave pattern, which is similar to the alpha waves. So we will come back. What is that alpha wave? Now, so that means the functionality of the reticular system is essential for recording the brain waves. If the reticular system is non-functional, is not working, so then it is practically coma. It is not in arousal state. So in that situation, you will not have those wave patterns. So transaction of the thalamocortical projection result in what is called a synchronization. Now, just trying to remind you about what is synchronization. Synchronization here in the brain is a high frequency activity is lower to a low frequency regular activity. So that is the synchronization. So this is about the brain areas involved. So that means I would project upon the thalamus, the reticular nucleus of the thalamus, and this is essential, and the reticular system is essential for producing these wave patterns. Now, looking at a particular graph, you can just see here the pyramidal cell. This is a pyramidal cell layer. And this pyramidal cell layer, you can have the projections to the outer layers. This is the 6th layer. So you have the scalp here, the skin, the skull, and the dura mater, and the whatever arachnoid and pia, and then you have the layers here. There's the subarachnoid space there. Then you have the pia mater here. This is the pia mater, and after that you have the neurons. This is the outer plexiform layer wherein all dendrites coming from the deep layer 4 and layer 5. They are projecting, even layer 6 also projects upwards. So they are coming there, and they would produce the whatever the sync activity. You can just see that sync activity plus minus. So this plus minus poles that creates the electrical activity, and here is the point where we place the electrodes, and we try to pick up this activity here, and this activity is picked up as plus minus in reference to another electrode. So that means we are placing between 2 points. So one point to the other point, what is the relation? Suppose if you are placing at 2 points, one may be non-active at a 0 level, another may be active. That is how plus it goes up. If that is reversed, it goes down, something like that. And this is what it is. So the highest influence of EEG come from the electrical activity of the cerebral cortex generated by the pyramidal neurons, and it is summation of these excitatory and inhibitory potentials, and a large group of neurons which when they are sending, they are mostly not precisely synchronous, mostly synchronous. Okay, so now coming back here, how EEG is recorded. Now I'm not going into the backwards. I'm just going what is the current the recent situation, how we are going to record the EEG. So that means to record any, say if you are going back with the ECG, what you require the electrodes, you require the leads, the positionings, and you require the amplifiers. Similarly here, so where all you position. So now here, this is a scalp. On the we have the top view. This is the top view. This is the nose there, that is called an asion, and this is the vertebral back of this. This is inion, and between this inion and nasion there is 100%. That's what. And we record the position the electrodes, what is called a 10-20 system. Now we have here one electrode, the red ones is the left side, and the right ones, blue ones are the right side. So that means there is already a configuration. So this is left side. So again, the numbering also 1, 3, 5, 7, something like that. All odd numbers indicate the left side of the hemisphere. All even numbers indicates the right side of the hemisphere. You can just see that 2, 4, 8, 6. Like that. So you have that all these things, even numbers indicate these things. And the same thing if you are the societal view, if you try to look at the societal view, you have the inion here, you have the nasion here, the nasal component, and this whole thing is 100%, whatever the distance is, and 10% distance, this is FP1 is given, this one, then if this second part, F7 is here, so T3 is here, then T5 is here, you can just see, then 01 is here. So now you have these placements of the electrodes. So it appears very weird and very confusing to us, but it has been worked out much easy for us when I show subsequent figures. Hello. Any question? Please communicate. Anything you wanted? Okay. Now move on to this. I just read this thing. This is called a 10-20 system. I wanted to impress upon. This is 10%. The distance between is 10% or 20%. That is what is called a 10-20 system. The standardized placement of the skull electrodes. These are the things. Since it is just you have to have an idea. These central portions or the neutral portions, they are grounded portions. The standardized placement of scalp electrodes is used here. The 10-20 is the percentage distance. If you are looking at the percentage distance here is less, it is more. This is 10% here, this is 20%, 10% and 20%. These points are marked as FP for frontal, this is frontal. Then central is C, parietal is P, the temporal is T, and occipital is O. So that is how they are nomenclature. This is the standard nomenclature used currently. The midline electrodes are marked with a subscript Z, stands for 0. So that means F0, central 0, parietal 0. So these are 0 lines or grounded lines. Okay. The odd numbers I mentioned, odd numbers used indicate the left hemisphere. The even numbers indicate the right hemisphere. That is the configuration of the EEG electrodes. Okay. This is how they are placed. It's a little in between. The old method was much more complex. Now it is the second old method. You have those electrodes placed here, and these are taped here. You can just see that they are taped in different portions. So now when you are placing these electrodes, you have to take a lot of precautions so that it should make a very good electrical contact, because there should not be any grease, oil left with here. So now once you have done that, so you have these cables. These are very highly flexible and they should not be rigid. If they are rigid, it will just come away. So that means that is how it is placed. So now, but this is very complex, because the person may not be wonderfully feeling about it. He always feels that I have been wired all through my head. So now these are the electrodes used, and this is how he was cabled. He was cabled using these electrodes. These electrodes have their discs here. This is a disc here. This is silver material, and this disc is now along with the gel. They connect it, and they will connect it to the different electrodes of the whatever the system we are using. However, now we have modified, or the technology is so advanced. This is modified and made a cap-like situation. So you made caps, and these caps exactly fits into the various electrode patterns in the 10-20 system. You can just see this here. So you have this central, and like this left hand side, this is the cap, and you just put the cap there. You don't have to worry. Only thing that you see that particular location is freed from hair, and if there is a hair, maybe it may be better to save the hair and clear it, and maybe prepare the part. So this is how the electrodes are placed, and this is what if you are going to be a neurologist and you are going to use such type of electrodes in future. Again, each electrode is labeled. Again, frontal, temporal, central, or whatever they are used, and the numbering is also codified. Okay. Now, you see that? I say this is what the type of electrode placement. I have just taken it figure like that. It's something like a facet design or a type of a cap. So wherein you place the electrodes, and no mess, that one feels. See this girl feeling very good. See her electrodes is being. She is bald there, and you can see the wires coming up. So now these are all the various electrode placements they have made for her, and this is how it looks when you make your own these things. Previously, it was not like this. It was more complex, and it was all wires all together, and it was difficult. And the EEG itself, the patient was rather he was scared, because it does not. You are not giving any current. You are recording current, or you are recording the electrical activity on the head. So now going on to the next. So this is what you record. You record the electrical activity of the brain. This electrical activity has a pattern. So when you record, what conditions you apply, so that we have to see. So that means here are the recordings. We have a beta, alpha, theta, and delta waves. So these are 4 type of waves. I will just go one by one with this. Okay, you just see that a different waves pattern. The signal intensity of the EEG activity is very small. That is why our recordings amplifiers are very high amplification. It is recording in microvolts. The frequency of the waves range between slow to 0.5 to 50 hertz. So you have these frequencies, they are ranging within the waves. Also you can have these frequencies. So now these are the 4 waves or 4 different waves we record when we. So first one, we have taken the beta waves. Beta waves. So I will start with alpha waves. These alpha waves are the waves in which the person sitting quiet in a dark room and no sound, and he's not disturbed. He closes his eyes, and when he sits with that, and he gets the activity something like this. Okay, so now this activity, this is a alpha rhythm or alpha waves. You can just see these waves between their frequency of these waves, or the number of occurrence of these waves is 8 to 13 hertz. So they are the waves, but they are larger in amplitude. So they are 10 to 20 microns. Okay, so these are larger in amplitude. When this person suddenly changes, so that person is now disturbed, maybe a light is on, he opens the eyes. When he opens the eyes, these pattern, these whatever the wave pattern disappears, and there are smaller waves come up. The smaller waves come up, and these smaller waves with higher frequency, you can just see that frequency of these waves here, they are high. You cannot expect the same like EEG, but they are totally asynchronous, or they are not very regular in a pattern. So that means these are beta waves. See, these are beta waves. So these are 14 to 30 hertz, and amplitude is 2 to 30 microvolts depending upon the situation. So then when we close our eyes, we start sleeping. We just try to go to the bed and try to sleep. Slowly these waves becomes larger and larger. So you just see that the waves are larger, and once these waves are larger, these are called theta waves. These are theta waves, and these theta waves, but they have become slower. If you just come here, this is the fastest, this is the second, this is the slower mode. So the 4 to 7. So if I were to tell, then we have another wave when we are in deep sleep. We have these slow waves coming up. The frequency is around 3 hertz, 3 per sec, and a very high amplitude, about 100 microvolts. So that means from slow 1 to 3, 4 to 7, 8 to 13, then 14 to 30. So that means like that we have 1 to 4, 4 to 7, then comes here 8 to 13, then comes this one 14 to 30. So that means these are the frequency. I have arranged here according to the frequency: 14, 13, 14, 8, 7, 4, something like that. Okay, let us see each of these waves, how they are and what they are. Now, just I'm trying to give you a table of those wave pattern. You just right now don't worry about the gamma waves. I have not talked about it, and I will talk about it at the end of the describing alpha, beta, and this. The beta waves I have taken, beta waves, they have a frequency of 13 to 30 hertz. They are high frequency and low amplitude, that is 2 to 30 microvolts. And they appear when you open your eyes, when you are stimulated, when some other stimulus is added. So that then you are relaxed, but there is an attention. So when during this condition you will get these waves, and in anxiety person or a neurotic person, these waves are dominant. They are dominantly seen. These are called beta waves. Then comes the alpha waves. Alpha waves, you are relaxed, sitting in a dark room, no external stimulus, no external sensory stimulus of whatever modality, and you don't have the you are not disturbed, and you are not thinking anything. Suppose you start thinking, you wanted to see that what happened yesterday's question, you start thinking about that even you have closed your eyes, so then it will all be coming back to beta. So that means passively relaxed, not thinking, in a sort of a meditating, or in a start of these things. So in that situation you will get a 7 to 13 frequency alpha waves, and they are 30 to 50 microvolts in amplitude. Then if you are deeply relaxed, that means as you are feeling drowsy when you are sleeping, you get these 3 to 7 hertz, and the 30 to 50 microvolts is the amplitude. So then delta waves, they are if you are during deep sleep, you get these. When you are dreaming, you get these. These are low frequency, around 3 hertz, and high amplitude waves. So then when you have opened your eyes, you are doing some external stimulus. When you have the alpha rhythm, this is called alpha rhythm. When you have the alpha rhythm, and suddenly I gave you that means right now you are having an alpha rhythm and you are listening to my lecture. So that means you are concentrating what I am trying to teach, and what I am trying to tell, you are trying to understand. During this time, you get gamma waves. When you are attending, and when you are trying to understand, this is a problem solving, problem understanding. So when this cognitive, because there are so many things happening. One, auditory. The second, the visual input, the slide you are trying to see, and all these things put together, all association areas, when they are working, you get a high frequency waves. So these high frequency waves are of the higher than 35 hertz. This is 30 hertz, 30 to 80 hertz. These waves come, and they are low amplitude, and they are for focusing or for understanding. So these are called gamma waves. Let us move further. In the sense here we have beta waves. First I will describe the beta waves. Here on this side I have taken some EEG recordings from Guyton. These are the waves when the eyes were closed. The person is sitting in a nice cozy room and eyes closed. You have these waves. You see that the tall waves are bigger waves and with a slower frequency. Then suddenly he opens the eyes. He was asked to open the eyes, and he opens the eyes. What happened? What happened? So this becomes fast. The waves become fast and low amplitude. Then again, when he closes his eyes, they become slow. The process of the fastness to slowness. Here what happens? There is a fast waves when we have the sensory inputs coming to us when the eyes are open. Then it becomes slow when we close our eyes. This is a beta wave, this is a beta wave, and this is alpha wave, and this is called synchronization. Synchronization means these waves become synchronized, they become taller and bigger. Here they are irregular, faster, and less in amplitude. So this is a synchronization. This is called a decreasing trend, and the synchronization. Now beta activity is the fast activity. The frequency is 13 to 30 hertz. Amplitude is 2 to 30 microvolts. It is usually seen in the frontal and parietal areas. The frontal area is this, parietal area is this. It is between the frontal and parietal areas. It is generally regarded as a normal rhythm when a person is alert or active with their eyes open, because you see that when you open your eyes, or when you are active, you are thinking, not only eyes open, maybe you may be doing calculations with eyes closed, or you may be thinking something else. So all those eyes open, or doing other mental activity. So what I would say that eyes open, or doing mental activity, or mental activity. So when you have that type of situation, you get the beta rhythm. So now it is dominant rhythm in the patients who are anxious. The persons who are anxious, you get this type of activity. So that means you don't have these alpha activity, you have a beta activity. It is accentuated, or this becomes larger. So that means in a sedative or hypnotic drugs, that means the more, because that suppresses all these things, especially the benzodiazepines and barbiturates. So these are hypnotic drugs. This becomes accentuated, this becomes larger. That means it becomes alpha waves. It may be absent or reduced in areas of cortical damage. So if there is a cortical anoxia, or a cortical damage, or a ischemia, so that means these waves disappear. That is about the beta waves. Now come back with the alpha waves, because I started with the fast waves. So then I'm coming with the slower waves. These are alpha waves. You just see that when the eyes are closed, the person is not thinking anything. He is cool, he is fine, not disturbed. Under these circumstances, you have a large amplitude, low frequency. So the previous frequency was around 13 to 30 hertz. Now it is a 7 to 13 hertz, 7 to 13 hertz frequency. That is a slow waves. These are slow waves as compared to these. You just see that. And the amplitude is larger, 30 to 50 microvolts. They are larger, and they are seen in the posterior occipital and the some part of the parietal areas. They are best seen in the occipital and the parietal area. So, and little higher amplitude on the dominant hemisphere, dominant side. So I am a right-handed person. I have the left hemisphere dominant. If you are a left-handed person, the right hemisphere is dominant. That is one aspect, a dominant hemisphere. And this dominant hemisphere, where we are using the maximum for all our interpretations. So that dominant hemisphere, the amplitudes of these waves are a little larger. It appears when closing the eyes and relaxing, and disappears when the eyes are opened, and or you are doing any thinking or calculations. I have already mentioned about it. It's a major rhythm in a normal relaxed adults. It's a major rhythm. It is present in most of our life, especially after 13 years. It's before 13 years, still there is a lot of things happening, and maybe you may have the alpha rhythm and some other rhythm may be there, but in most of the after the adolescent and adult period, so this exists and this remains. Then comes the theta waves. Theta waves of the EEG are the slow waves, and these waves are larger amplitude and lower frequency, 3 to 7 frequency, and they are mostly seen in children below 13 years. As the age increases from 1 to 13, this theta rhythm decreases. Theta activity decreases. Otherwise, theta activity is greater in younger children. That means a 1 to 2-year-old child than a 13-year-old boy. So early stages of it is also appear in early stages of sleep in adults. So when I am becoming drowsy, then I will have these theta waves appearing. It can, so that is about, so but it will, in case of the subcortical ischemia, focal subcortical ischemia, so these waves may appear. So that is the theta rhythm may come when there is a certain areas of the brain are involved. It can also be seen in generalized distribution or diffuse disorders like encephalopathy, anoxic situation, or some instances of hydrocephalus, theta waves. Okay, so now these are slow waves, large amplitude, appear during sleep and seen in children and in adults in sleep. Now comes the delta waves. The delta waves of EEG, their frequency is 3 or less, 3 hertz or less, and very high amplitude. And these are dominant in infants. Infants, mostly in out of 24 hours, the infant may be sleeping, the newborn infant may be sleeping 16 to 18 hours. So it is most of the time they are dominant. But in adults, they are seen in the third and fourth stage of the NREM sleep, non-rapid eye movement sleep. Third and fourth stage, you get these waves appearing. But in abnormal conditions like subcortical lesions or in a diffuse lesions or a metabolic encephalopathy, hydrocephalus or a deep midline lesions, they will produce the delta waves. So these are some of the conditions which are affecting the delta waves. Then gamma waves. Gamma waves of EEG, their frequency is 35 to 80 hertz. Amplitude is 10 to 20 microvolts. These are high frequency, low amplitude waves appear during concentration of an activity or problem solving, as you are doing right now. So during this time, if I record your EEG and I may get the gamma waves, if you are attending to my lectures. It is because of the simultaneous processing of the information, involvement of the association cortices, and that is an indicator of the gamma waves. So this speaks the function of the gamma waves is for the perception and consciousness. It is for the higher level of cognition. Now I'm just summarizing these things again one more time. You have the high frequency beta waves here. Okay, they are present in the frontal and parietal areas. So then you have the alpha waves here. See the difference between the alpha waves. They are large and low frequency. You can just see that. And they are recorded in the occipital and parietal areas. These three recordings are the alpha waves, and this is the theta waves. The present in children and in sleeping adults. You can just see that these waves are coming up like this. So these are theta waves, a low frequency between 4 to 8 hertz, but the amplitude is greater. If you are looking at the amplitude is greater. So now then if you are in a deep sleep, you have the delta waves. These are delta waves. So that means they are slow, 3 hertz or 4 hertz, and they see mostly in the infants and these things. These are the waves in epilepsy, petit mal epilepsy. I will come back to it at the end. Right now, I don't want. Maybe I will come back again. So you have a different wave pattern. Now, coming back, what are the brain rhythms? If I want to summarize, alpha rhythm, which is having a alpha waves, beta rhythm, beta waves, that is present in alertness. That is when a resting condition with eyes closed, alpha rhythm. So then it is related, gamma rhythm is related to sensory integration and sensory feature. Theta rhythm is slowing down and sleep induction. Delta rhythm is sleep. So now what happens, sometimes this theta rhythm comes in spindles. The slow waves comes in a spindle, what is called a sleep spindle, and this forms the complex. They are having a 0.5 hertz. This is a kappa complex or a K complex. So these two things I will talk when I talk about the sleep in the next class. But anyway, these are some of the brain rhythms we have to think about. Now what are the uses of EEG? One, the EEG is used to study the sleep, what is called a somnography. Somnography means we want to study the sleep. Why we want to study the sleep? Because quite a good population, they don't get the proper sleep. So that means you people are young and now you are sleeping more, and as the age advances, the sleeping hours decrease. So to study the sleep and the sleep abnormalities and various conditions, because that may lead to many of those about somatic conditions. So that is study the sleep. Then there is what is called a sleep apnea syndrome. So that also, to study that, we need to use the EEG. And to know the coma and brain death. Especially if there is a brain death, there is no activity. So no EEG. So that means, or a coma, you don't have those synchronization and these things. You may have a wave pattern altogether not matching with anything, or you may not have. So coma and brain death, because a coma is a condition where reticular system is damaged, or reticular system is not communicated with the cortical system. So that means you have that synchronization is lost. Then in case of brain tumors and head injury, you may have to try to use the EEG. And especially it is used to study the epilepsy, different types of epilepsy. And it is used to study the headache, migraine. So whether there is any brain tumor associated, or whether there is any brain lesion, or whether there is any pattern. So that for that reason you have to use it. So then the psychiatric disorders, the EEG would be useful. So I have mentioned what are the uses of EEG. Yes, these are the uses of EEG. So that means first I will talk about sleep and sleep related disorders, the coma and brain death, the brain tumors and injury, epilepsy, headache, psychiatric disorders. You will be able to remember. Then comes, I'm just coming because here I mentioned about epilepsy. Now I want to bring in the epilepsy. We have three waves, because some of them come as a short note to you. That is why I have made an attempt. So these are some of the EEG patterns. So you can just see that large amplitude, high frequency waves. These large amplitude high frequency waves are seen during the attack of the grand mal epilepsy. Grand mal epilepsy is a generalized convulsions. Generalized, you must have seen some persons fall them on the street. Suddenly they will have a convulsions, and they will be having some abnormalities, and you must have seen and experienced and these things. So these are called grand mal epilepsy. These seizures, they are because of the increased synchronous action potentials of the various brain areas, and these action potential produce the convulsions. And once they produce the convulsions, the person loses consciousness, and then he will have a subsequent effects. Because I will not go into the details of the grand mal epilepsy, but you will see that the asynchronous large amplitude wave pattern seen in the grand mal epilepsy. I have mentioned here produce stereotypical involuntary spasms, what we call as convulsions. So then there may be alteration in behavior. He may have headache. He may be depressed, and he will come back to normal only after some time. The seizures may be, sometimes they may be partial. Some part of the body may have that, or it is generalized convulsions of the entire from top to toe. So they may have that, depending upon the location of the point where it stimulates or triggers the activity. So that the trigger of the activity is the abnormal, that produces the abnormal neuronal discharge. So now each type of seizure displays a different EEG pattern. So that means in these situations you different pictures altogether. However, during a non-epileptic, when he is not having convulsions, he may be having a normal EEG, because this EEG is seen only when he has an attack. So this that means when he gets an attack, we don't know. Under that circumstances, it is very difficult to only think hospitalized patient trying to get the convulsions they may get, or we may trigger convulsions by producing some hypoxemic status, or then but no doctor would like to do that, and we don't want to do it to induce the convulsions. Okay, that is about a grand mal epilepsy. So I have given the points there. You try to remember. So now we have another epilepsy, what is called a petit mal epilepsy. Petit mal epilepsy is a transient loss of consciousness. Transient unconsciousness, because a person is there, a friend of you may be sitting there, and suddenly you are talking to him and he does not respond to you, and he is not caring about you, and again he comes back to normal. So such thing may happen sometimes in some individuals very frequently, some individuals maybe once a month or so. So that means this the transient, the loss of unconsciousness is only for 3 to 30 seconds. You can just say within a minute. This is associated with the twitchings of the face muscles, mostly the face muscles. There is a twitching of the face muscles. And if you record the EEG waves during such attacks, you get these spikes. You can just see the spikes here. And these spikes, so spikes and a dome. This is a dome and a spike. Spike and dome pattern of EEG waves are seen in petit mal epilepsy. Whereas in grand mal epilepsy, there is a total asynchronous high frequency activity. Here, a spike and dome pattern, which is seen here, and you can just see these amplitudes. These amplitudes here double than this. Okay, then this results from the oscillation of the inhibitory thalamic reticular neurons, which is GABAergic, and the excitatory thalamocortical corticothalamic neurons, that's glutamatergic. This is the oscillations between them, and because of that you get this the spike and the dome pattern. Okay, so now this is less harmful than the grand mal epilepsy. Grand mal epilepsy is a real big real thing for the patient and the patient's relatives and even the person attending to him. Then we have another type of seizures. So these are called seizures. These are psychomotor seizures. So these psychomotor seizures are coming from some problems in the limbic system, especially in the amygdala, hippocampus, septum, or other parts of the temporal lobe. When they are involved, when they are going into hemorrhage or ischemia or anoxia, you may get a psychomotor, or anything associated with the psychiatric illnesses, you may get this type of psychomotor seizures, and they are lasting for a short period. They are lasting for, but they are associated with the loss of memory, amnesia. During this period, they do not remember anything. And they are associated with a normal attack of a abnormal rage. That means they become aggressive and they become angry. That's a rage is a phenomena in which person is trying to respond. Sudden anxiety, discomfort, or fear that may trigger these attacks. That may trigger these attacks, and it is associated with incoherent speech. Incoherent speech. Sometimes he may try to give a speech which does not carry any meaning, or which may be abusive, or which you might not have heard that a particular person is speaking such a word. So now that is a psychomotor, and then he does not remember what happened during this period. What happened during this period, and even after that also there is some period of memory loss. Now this is usually associated with the limbic system. The parts are amygdala, hippocampus, septum, and other parts of the temporal lobe. They are involved. So now what you get here is the low frequency rectangular waves. So these are rectangular waves here, low frequency waves. You see these waves very frequently. And these waves are again spiked with high frequency waves. You can have these high frequency waves. So that means there's a complex wave pattern. So this is psychomotor epilepsy. Now I covered three types of epilepsy, and you can just see them. Now, just to give, this is I have taken it from Guyton. So now I want to bring back here. This is infants. This is the slow waves there. Then relaxation, you get these waves. Attention, these waves become less. Then during grand mal epilepsy, these waves become frequent. These waves become fast component. So then the attention means the fright. That means you are fearful, or you have to run away. So that means that increases, and this will be deteriorate in the epilepticus. This will be deteriorated. These are part of the rhythm in the psychomotor epilepsy. During sleep, we have the slowness, the delta and theta waves. And this may same thing happen in case of a surgical anesthesia or in a confused state. That means a stupor. So these are the things I have taken. This is the basic rhythm that talks about everything. Okay, so now again I repeat these different waves: beta, alpha, theta, delta. Now I bring back here the petit mal epilepsy, the spike and dome pattern. I will not go into the details, and you just summarize. So the beta is when eyes are open, and this is eyes closed, not thinking any damn thing. Then first stage of sleep, the deep sleep, and in petit mal epilepsy. You can just read about these things. Now, the keywords for you, that means different EEG waves, genesis of EEG waves, uses of EEG that I have covered. Now, if I were to next class, what I will do, because I have given the background of the EEG, I will now proceed with the physiology of sleep in the next